This brief video will provide an overview of a multi-site infant lumbar puncture educational project being conducted at your hospital through the POISE network. It will also describe just-in-time skill refreshers and how you, as a supervising physician, can help. During orientation, all interns completed a mastery training session to develop their infant lumbar puncture procedural skills using a benchtop simulator and one-on-one teaching. By the end of this session, all interns at your hospital had achieved mastery standards. Unfortunately, skills will deteriorate over time when they are not used, and when lightning strikes and an intern is called upon to perform a clinical lumbar puncture, they will need to refresh their skills to mastery standards. Throughout the year, skills will continue to deteriorate, and when interns are called upon to perform a clinical lumbar puncture, we ask that you conduct a just-in-time refresher before any clinical lumbar puncture. What is a just-in-time refresher? This is a very brief, approximately 5-minute coached refresher that uses a benchtop simulator just in time, just in place before a clinical lumbar puncture. Simulators are available in your clinical area. This is a great opportunity for hands-on teaching as you provide feedback specific to the individual learner's needs. The goal of this intervention is to polish the intern's skills before they perform a clinical lumbar puncture, so as to optimize their performance on the real infant patient. The refresher details are as follows. First, obtain and set up the simulator. The simulator is available in your clinical area, and instructions for setup are with the simulator. Then, supervise the simulator lumbar puncture. You will ask the learner to show you what they know and demonstrate their infant lumbar puncture skills to the best of their ability. You will then provide feedback and answer any questions that the intern may have related to this procedure. After completing the simulator LP, you will complete side 1 of the simulator form. Then you will supervise the clinical lumbar puncture. After completing the clinical lumbar puncture, you will complete side 2 of the clinical lumbar puncture form. If you fill out the paper form, please place this into the POISE box in your clinical area. You may also fill out the assessment form online. A prompt is a teachable moment or a verbal interjection to either prevent or correct an error during training. A global rating scale will be used to assess providers' level of independence at this procedure. We do not expect many of the intern providers to achieve an expert rating on this scale. A beginner is someone who required extensive guidance, more than 2 prompts. A competent provider is someone who required minimal guidance, such as 1 or 2 prompts. A proficient provider performed independently without prompts. And an expert provider is someone who performed independently, confidently, and efficiently without prompts. If you feel that it is not safe for your learner to perform a clinical LP on the real patient, this is at your discretion. Please document this on the data collection form and notify your POISE site director. The following videos will demonstrate examples of just-in-time prompts from teaching sessions.
Great, now that you've sterilized the baby, tell me how you'd like me as the holder to hold the baby for you.
So what I want you to do is grab the head, grab the knees, and sort of flex the body and bring the 2 together as much as possible.
Okay, like this, you mean?
Yeah, exactly.
Okay. So actually it's a common misperception that you should hold the baby at the head and neck, but it could be dangerous because if you flex the baby's head and neck too much, it can compromise their airway. So I would always instruct the holder to hold instead at the back, okay, right below the neck. And then, as you mentioned, to flex as much as possible to really open up those spaces.
Okay.
Let me stop you for just a moment.
Okay.
So I see that you're scrubbing the betadine on. Actually, when you use betadine, it's best to use it in concentric circles so that you can put a thin layer on and give it time to dry, and that's actually how the betadine works, is it becomes bacteriostatic once it dries off on the skin. So do you want to try that again?
Sure.
Perfect, yeah, excellent.
I'm not really sure what I'm doing wrong. Nothing, it's not working.
Okay, just take a step back and take a look at the angle, and what do you think of the angle that the needle's at right now?
Oh, I see. It's pointed to upwards too much.
Exactly. Sometimes with all the drapes, it's hard to keep track of, the anatomy. So what you can do in this case is pull back the needle without coming out of the skin, and then try to redirect at the proper angle. So how do you want it to be?
Perpendicular to the umbilicus.
Exactly. Perpendicular to the skin and angled towards the umbilicus.
Okay.
Okay, so why don't you give that a try? Perfect.
These videos have reviewed prompts or teachable moments during an infant lumbar puncture just-in-time refresher. A prompt is a verbal interjection to either prevent or correct an error. You may have noted that the supervising physician allowed the intern to commit the error, then provided specific feedback, and lastly asked the intern to perform that skill step independently and correctly on the simulator. The global rating scale will be used for the simulator session as well as for the clinical lumbar puncture performance. To review, a beginner is someone who requires extensive guidance or more than 2 prompts. A competent provider is someone who required minimal guidance or 1 or 2 prompts. A proficient provider performed independently without prompts, and an expert provider performed independently, confidently, and efficiently without prompts. As a reminder, we do not expect many interns to achieve proficiency or expertise in this session. Near-miss events are also collected on the data collection form. On this chart, you will check steps where errors occurred or where you prevented the learner from making an error during the simulated or clinical LP. These steps include sterility, positioning the baby, choosing the correct interspace, and needle advancement. We thank you for your time in teaching interns using the just-in-time refresher paradigm. The sites on this slide are involved in the POISE, Patient Outcomes in Simulation Education Infant Lumbar Puncture Training Intervention. We thank Our Baby for their generous support in providing models for all participating sites.